So we have a lot of people from a lot of different organizations joining us today. And some of you may not be familiar with one or both of the organizations that will be speaking today. So I just thought I'd say a little bit about the two organizations that you'll hear from. PolicyLink is a national research and action institute working to advance economic and social equity for low-income communities of color. Their work is grounded in the conviction that equity, just and fair inclusion, that is, must drive all policy decisions. And you can find out more about PolicyLink at their website, which is policylink.org. SSTI is a network of reform-minded state DOTs. We were founded in 2010, and we're at the University of Wisconsin. We work in 3 different ways. We are a community of practice where participating agencies can learn together and share experiences as they implement innovative smart transportation policies. We're also a source of direct technical assistance to agencies on transformative and replicable smart transportation reform efforts. And finally, we're a resource to the larger transportation community, including local, state, and federal agencies as they work in their efforts to reorient practice to changing social and financial demands. And you can find more information about SSTI at our website, which is ssti.us. The 2 speakers that you'll be hearing from today, first you'll be hearing from Mary Ebeling. She's a transportation policy analyst at SSTI, and she has a master's degree in urban and regional planning from the University of Wisconsin. Before she joined SSTI, she worked for the Wisconsin Department of Transportation in the public transit section, managing their ERA projects. And she also, previous to that, managed the non-motorized transportation pilot project for Sheboygan County in Wisconsin. She's going to be talking a little bit about some of the work that SSTI has been doing on measuring transportation equity and equity measures for investments in transportation. After that, we'll be hearing from Erika Rincon-Whitcomb from PolicyLink. Erika is a senior associate, and her work supports state transportation advocacy and research to address infrastructure, environmental, and health inequities facing low-income communities of color and disadvantaged unincorporated communities in California. She's going to be talking a little bit about her work in California, but she'll also be talking about PolicyLink's larger efforts at the federal level. And she holds a dual master's in city planning and public health from the University of California in Berkeley. So I'm going to turn over the presentation to Mary Ebeling, who will take it from there.
All right, thanks, Robbie. Thanks, everybody, for joining us today. This is going to be a really interesting conversation. So now I got to make sure I've got the actual controls here. All right, there we go. There we go. Okay, so why measure equity? We've been developing a project to measure equity in transportation investments to help departments of transportation, cities, regional planning agencies meet goals of improving equity outcomes in the transportation system. These groups are growing more interested in evaluating the equity impacts of transportation and recognizing that our current system has not always produced equal outcomes for everyone. However, there's a lack of a clear framework or consistent set of measures for conducting a comprehensive equity analysis that's sort of hindering the evaluation of equity in transportation. And we're hoping that our framework that we're presenting here and the measures we're proposing can help serve as a starting point for consistent equity analysis. Our analysis is focused on evaluating how proportionately or disproportionately costs and benefits are distributed of the transportation system are distributed across the different groups or segments of the population. For example, we may be interested in whether one group of people has poor access to jobs and amenities compared to another group, or whether transportation is less safe or more costly for one group of people compared to another. Today we'll focus on equity for low-income populations, although much of what we discuss could be modified for other groups in the future. Yeah. So equity performance measures. When considering measuring equity, we thought it important to start developing performance measures to aid in making transportation investment choices that are equitable. Planners and agencies can use these types of analyses to select projects that improve transportation options in identified neighborhoods lacking these choices. Some of the measures that could be used include, evaluating how investments impact access to jobs, healthcare, education, safety outcomes, to name a few. We're going to ask questions such as, how do changes in land use that increase density and mixed use change travel behavior? How does the addition of a transit line improve food access? Or how is access to goods and services in a neighborhood changed if driving were the only option in that neighborhood or census block prior to the addition of this transit line I just mentioned, or maybe the completion of a sidewalk or a bicycle lane? These types of questions can be asked of the existing transportation system and also used to evaluate and prioritize projects during the project selection period and prior to the commitment of funds. They can also be used to measure change over time. And I want to emphasize here that we're comparing, within a community, we're comparing across populations. So census blocks that are characterized by low-income communities versus census blocks that are characterized by a median income community is one example of how that might happen. We also thought it important to develop an equity framework to help guide our project. And transportation planners and designers facility designers are accustomed to measuring vehicle throughput in order to evaluate system performance. So the framework that we have up on the screen might be a little bit different than they're used to seeing. And unfortunately, the normal framework, the common mobility measures and metrics such as delay or level of service, typically don't properly reflect equity issues and other community interests. So for example, measurements of traffic flow through a particular community don't necessarily reflect how easily community members can get to work or what other impacts of traffic flow might be on their health or well-being. So when we're thinking about different types or dimensions of equity to consider, some clear themes rose to the surface relatively quickly. And I'll talk about each of these separately. I want to talk first about accessibility, as it is access to transportation that seems to be the driving force, no pun intended, and other equity measures. I'll then move through opportunities for evaluating affordability of transportation, as well as health and safety. And also of note, while we identify procedural equity, or essentially public input and stakeholder involvement as an element in transportation equity analysis, we found it to be essentially a different measure than the others. So we're not focusing on it here today, but the intent as we develop the project further is to return to this measure and further develop tools for assessing it. And today we're focusing on lower income communities in comparison between low income and in communities that census blocks within a community that are low income versus ones that are not. There are other considerations in the future that communities may want to look at, such as race and gender, but for simplicity, we're focusing on just one today. All right, this is an interesting map. I want to, it's basically moving into looking at accessibility. Accessibility really becomes a primary measure as we're looking at average travel time to essential destinations, so not just jobs, but a suite of destinations, number of amenities, services that are relatively accessible by any mode, and also accessibility also accounts for a transportation network, so cumulative or rolled up opportunities. So once again, looking at more than just one destination, so not just jobs, but healthcare, education, and other important destinations for communities. And past practice has focused primarily on accessibility to jobs, which I mentioned, and that provides a limited but important understanding of travel patterns and obstacles. It focuses, the data that it uses is census data, American Community Survey, which gives you information on travel times, mode of transportation. There's also data available through travel surveys, and we are looking at hopefully having emerging new sources of data from GPS, data from mobile phones, navigational devices, wearable fitness devices. These promise to offer additional, more nuanced information into travel patterns and to other destinations by multiple modes. So this map is interesting. It shows access from households to any given point in the city by transit. So we're looking at the shading of the blocks. The darker blocks have lower access, so fewer households in that block can access any other place in the city via transit within a 30-minute threshold. Yeah. And so the next thing I was planning on saying is that we had decided to use Madison as our test case, Madison, Wisconsin. And it's pretty convenient since we're already here that we did this. And that's our test community. We're also working with, and this map was produced through Sugar Access, which is a GIS-based tool currently under development. Through this tool, we've been able to ask questions about accessibility across the community by census block and by mode. And by being able to drill down to the census block level, we can get a better idea of how differing demographic groups, such as low income or racial minority groups, experience differing access throughout the city. It's clear from this map that different block groups experience different levels of transit access. And I just pointed out sort of the dark area down in the right above what is a highway in the middle. That particular group doesn't have good access by transit to any other place in the city. And I'm just picking that out as an example. So the equity analysis commonly measures access to jobs by transit, but we wanted equity concerns can focus on access to groceries, education, services, or other opportunities, and should include a wider range of modes, so walking, biking, transit, and driving. And for this reason, this is why we took a slightly different approach to our analysis and looked at access from households to destinations as opposed to the other way around. And the following analysis was done for transit, obviously, but the final product we envisioned including the multiple modes that we're talking about. And the next step here, this is not broken out by income right now, but that's the next step that we would do with this map, is break out using the data and the census blocks to get accessibility differentials between lower income census blocks and higher income census blocks. So that was sort of the overall accessibility, but one of the other things we wanted to do with the information was test accessibility from households to a variety of destinations in the city. And one of the questions we tried to answer was would we cite a new community college campus based on access to households? And this is a conversation that's going on in the city right now. You can see Madison Area Technical College downtown campus, which is site number 1, offers the highest level of access both in the under 15-minute travel time category and overall. It also offers the shortest travel time at 38 minutes. The site is in the historic core of the city, and I'll point it out. Well, it's number 1, it's right here. In a walkable area with abundant transit access. And as a side note, this campus is walkable distance to the University of Wisconsin-Madison, the state's flagship university, and the four-year school that many MAT students also take classes at while they're at MATC and also transfer to for a full degree program. Site number 2, which is the comparison site, is a proposed relocation of MATC campus, which shows terrible access by transit from households within the 15-minute time threshold, an average travel time of 46 minutes, which makes this trip significantly more burdensome to make than the trip to the centrally located campus. The additional time of approximately 16 minutes round trip per trip to campus adds, basically over an hour of travel time every week if you have to make, let's assume, 5 round trips a week, which places a significant burden on students and employees that need to access this site whose time is valuable. This is an important consideration because MATC is considering moving the downtown campus from Site 1 to Site 2 and probably presents or may present an access issue due to the large number of working adult learners who attend this campus who have other responsibilities, family, children, and multiple jobs. Before I leave this slide, there's numerous things we could discuss, but I also want to mention site number 6, which is in the lower left-hand corner. That represents the location of a major employer in the region. It's an example of location that's accessible within 45 minutes by car or transit to work, but the households there can't really get to anything else within that time threshold due to the spread out nature of many of the other destinations. So if we had just looked at job access, it would have looked great, but when we start to look at the multiple desirable destinations, it ends up looking not so good. So this suggests that the community could improve their transit equity outcomes by changing policies to encourage more compact mixed-use development that we know will support transit, biking, walking, and other short trips. So modes of travel also that are more affordable to low-income families. And this brings us to another accessibility consideration, the decay factor. Another way of looking at access to destinations is assigning a value or a weight to a trip based on the distance between origins and destinations. So recognizing that the value or likelihood a trip will be made will vary by distance, cost, desirability. So people are more likely to make longer trips for employment because that's a necessity versus shopping. And it's important to consider this factor in the value of a trip to a traveler. In the maps we just talked about, we looked at trips that could be made from households within a variety of time thresholds. And you can weight these trips in a decreasing value depending on how far away they are. It's kind of similar to walk score, which I think many people are familiar with, which basically aggregates different destinations. So whether it's a walk-friendly community, you can get to a whole bunch of a group of destinations, schools, libraries, restaurants, within a 5-minute, 10-minute, or 15-minute walk. And the scoring, the number score you get is based on how many things you can access within the shortest amount of time. So it's also important to note that the trips we're talking about, the accessibility metrics measure access to opportunities. So trips one could take, but not the actual trips or activities that people need to make. So for example, a person might have good access to a large number of jobs, which are opportunities, but has poor access to their actual place of employment, which is the activity. And travel surveys and similar data like journey to work flows from the census provide some insight into this actual activities. But right now we don't have very good information on exactly where people are traveling. We're hoping that the emerging data, location data from sources like the mobile phones and navigational devices will help parse that out more in the future. So the next thing I want to talk about is affordability. Affordability measures the actual cost or out-of-pocket travel costs in monetary terms rather than time spent or distance traveled. And we're using the Housing and Transportation Affordability Index, which is a tool developed by the Center for Neighborhood Technology, and it's readily available for analysis, which makes it very useful for agencies, cities, regional planning associations that don't necessarily have the ability to develop a new tool. The agency index sets a benchmark for affordability at combined housing and transportation costs of no more than 45% of household income. So here's another map of Madison that has the housing and affordability measures on there. We can see the central part of the city, kind of like the accessibility by transit by household, has the highest accessibility for transit, biking, walking. We know that. It looks similar to the earlier slide, and I could go back, but how'd that happen? Oh, I'm so horrible. That's all right. You gonna take control? I won't go back to that map. All right. This is the map I wanted to show you. So you can see there are some similarities. We have a high level of access in the downtown core, to the west as well. There are some outliers here that just due to real estate values that the H&T index can't really take into account. But in general, the general trend of accessibility by transit and the Housing Transportation Affordability Index, they mesh up fairly well. So let me just move on back to where we were. My apologies for the delay. So it's important to note that the affordability section figures into the equity thing, and the way that the H&T index is set up, they do analysis by census block, which is good because it's similar to what we're doing with the accessibility of households by transit. So it allows comparison of how census blocks in lower income areas and other EJ groups combined housing transportation expenditures might compare with other census blocks that are not categorized by lower incomes. So that is another way to start to dig into the equity issue. All right, moving to health and safety, which is our third element that we're going to talk about today. Good accessibility and affordability is important, and it's great. So you've got a neighborhood that's got good accessibility and it's super affordable, but if the transportation system poses considerable health and safety risks, these safety concerns should be addressed as well. And this is particularly true if one particular group puts another group at greater risk, such as by traveling at high rates of speed through another neighborhood or exposing them to harmful emissions. And sample metrics include things like serious and fatal crashes, which I have up on the slide, by neighborhood or by travel mode. And some of the data that's used, or the main source of data that's used for this and is most readily available on safety impacts, comes from the Fatal Accident Reporting System, FARS. Of course, we have to have acronyms, and it's provided by the National Highway Reporting Safety Administration. This database indicates the location of all fatal crashes in the U.S. By mode and includes the home zip code of the crashes, which is interesting from an equity perspective. You can, if you see a cluster of, say, pedestrian crashes, pedestrian trips aren't as long as other trips, so they're more likely to be in the actual home zip code. So if you're looking at a low income census block and you have a lot of pedestrian crashes, there's potentially an equity issue you may want to address. Bicycle crashes, the bicycle trip range is a little bit further than walking, but that may be in the general same area. It gets a little bit trickier when we look at autos because car trips are longer. We're still kind of digging into this a bit, but there's just some of our initial observations. And the data will allow us to compare crash risks between lower income groups and other income groups in a community based on what I just sort of alluded to. And it allows a risk assessment based on neighborhood locations. So we can ask questions about what are the risks to a low income census block group again versus a median income census block group. There's also data potentially that will help with the health and safety part of the project that's related to traffic impacts that might be available from local sources or might still need to be collected. Some of this data could include local emissions, air quality, noise impacts from decibel readings, and other like hospital admission reports as well. And I also want to talk about health impact assessments. These can be really good tools for equity analysis. I'm going to read the actual official definition of it. It's short, so bear with me. It's a combination of procedures, methods, and tools by which a policy, program, or project may be judged as to its potential effects on the health of a population and the distribution of those effects within the population. This is the World Health Organization definition. In considering an equity analysis, it's important that HIA's health impact assessments explicitly consider part of what's embedded in the methodology of an HIA is to explicitly consider social and environmental justice issues. And they do this in part by adopting a multidisciplinary approach and a participatory process that uses qualitative and quantitative evidence as well as working with a transparent stakeholder process. So it's a very interesting tool that can give us a lot of information on health and safety outcomes for an equity analysis. So the data that's typically used, the steps that they use, they screen the project so they determine whether or not there exists potential for health impacts of a policy or a program. So we can see how a transportation program or project would fit nicely into this. They develop a project area and then they work to disseminate information about potential. Once they've determined what the health impacts are, they work to disseminate and put forth a set of policies that they suggest to improve the health outcomes of the project. So they use census and crash data and data related to other traffic impacts to help develop these reports. And there's two reports that are up here right now. There's the Oregon VMT assessment, a health impact assessment, and there's also a health impact assessment for the Beltline that are pretty good, I think. And I can provide the web links if people are interested. And I'm just going to go through a couple things that the upstream public health that conducted the HIA for the Portland VMT, or I'm sorry, the Oregon VMT study. The recommendations that they pulled that came out of that, just a couple of them, were discussing how built environment land use and reducing the limits of sprawl will reduce VMT. So suggesting policies to increase density and limiting sprawl. Putting pricing on driving, so increasing the cost of driving, especially at the end destination, so by charging more for parking, and improvements to public transit. So we're sort of just starting to dig into the potential of the health impact assessments, and I think there's a lot there that can be used for assessing equity in transportation. Moving forward, I'm going to go through this relatively quickly because I'm a bit over time. We want to we'd like to see equity analysis incorporated into decision making. We have some data gaps we think we need to fill. We're working on finalizing the robust equity measures for additional EJ groups than low income, and sort of trying to play around with considering whether or not a composite equity score versus keeping the 3 equity measures I mentioned would be useful, or do we keep those measures separate, or do we combine them? And I think that might well be a very community-based decision. So thanks everybody for your time, and if you have questions or want to get those web links, just shoot me an email at the website on the screen.
Great. Well, thank you, Mary. And I do want to remind people that they can type questions into the question box, the chat box. And again, if you're having trouble finding the chat box, you can simply use the little orange tab in the upper right-hand corner of your screen, and then you'll be able to type in a question. I'm just going to answer one question that was typed in, and that was somebody was interested in the Housing and Transportation Affordability Index and whether that was easily accessible for each city in the U.S. I don't know if all cities, but I think most large cities and even medium-sized cities, and it is available from the Center for Neighborhood Technology. So that's one place you can get it. So we're going to go on to Erika, and we've heard from sort of the transportation end of things, and now Erika is going to talk about the policy end of things. So I'm going to turn over control to Erika, and you can take it away. Thank you.
Great, thank you, Robbie. Good afternoon, everyone. I'm going to talk today a little bit about transportation equity from 2 angles. One, looking at some just sort of trends and opportunities at the federal level that's rooted in a lot of the work that PolicyLink and other equity partners have been pushing for. And then I'm going to focus a little bit deeper on the work that a lot of us have been doing in California to advance equity in California's active transportation program. Oops, okay, there we go. So I just wanted to provide a quick overview on the Transportation Equity Caucus. I'm sure many of you are already familiar or involved with this, but for those of you who aren't, this is a diverse national coalition of organizations promoting transportation policies that are really looking to ensure access, mobility, and opportunity for all, but for particularly low-income folks, communities of color, people with disabilities, and other transportation disadvantaged groups. And it is informed by principles that advance economic and social equity. And one of its primary goals is to embed these principles and strategies into the transportation priorities of DOT and related agencies, as well as federal surface transportation legislation. There's over 100 members in the caucus, including national, state, and local organizations, and it's chaired by the Leadership Conference Education Fund and PolicyLink. And I encourage you to visit the website to learn more information. I also wanted to provide a great quote here by Dr. Martin Luther King Jr. on sort of a picture of transportation and equity that I feel is very relevant today. It states that urban transit systems in most American cities, for example, have become a genuine civil rights issue and a valid one because the layout of rapid transit systems determines the accessibility of jobs to the Black community. If transportation systems in American cities could be laid out so as to provide an opportunity for poor people to get meaningful employment, then they could begin to move into the mainstream of American life. And so, transportation very much today is that critical link to accessing opportunity. And for many folks, mobility can make all the difference in their ability to meet basic needs, participate fully in community life, and connect and contribute to our national economy. But millions of poor people and people of color live in communities where quality transportation options are unaffordable, unreliable, or non-existent. And here is some really great data that demonstrates this. This is from Bureau of Labor Statistics and National Household Travel Survey, and some data from Community Development Financial Institutions Fund and Brookings Institute. And I won't go through all the figures there, but if you read through them, I mean, it really showcases the level of transportation inequities across low-income communities and communities of color. Federal transportation policy choices regarding what we build, where we put it, who builds it, how we operate it, and what energy powers it have an enormous impact on our economy, our climate, and our health. Therefore, achieving equity in transportation policy will bring about fundamental improvements in communities across the country. Here are some of the guiding principles that have been developed by the Transportation Equity Caucus that really inform an equitable transportation agenda. Number one, create affordable transportation options for all people. Number two, ensure fair access to quality jobs, workforce development, and contracting opportunities in the transportation industry. Number three, promote healthy, safe, and inclusive communities. And number four, invest equitably and focus on results. In this next slide, I just want to discuss some of the efforts that many equity partners have been working on across the country that have really led to some sort of prioritization of equity in national policies. The first one is the Ladders of Opportunity program. Just last year, the Secretary Fox announced the awarding of 24 grants across the country that are really designed to modernize and expand bus service across the nation with a focus on connecting disadvantaged and low-income populations to centers of education, employment, job training, healthcare, and other vital services. One example is a project in Los Angeles that will be building light rail lines and creating apprenticeships for new employees. And so I think this program really reflects the understanding that transportation access to all types of critical amenities is really required to create the opportunity in the lives of those who need it. The next effort on the New Starts Grants program guidance, this happened in 2013, and this program provides financial resources for pretty much transit capital investments in locally planned or regionally planned and implemented projects. And through a lot of advocacy, there were new equity priorities embedded in the new rules and guidance that give preference to projects that serve low-income people, that foster health and safety by considering reductions in GHGs and traffic fatalities and other hazards, which tend to be more concentrated in low-income disadvantaged communities. And the program also now addresses displacement along new transit corridors by giving preference to transit projects in communities that plan to maintain and expand affordable housing. There has also been updated guidance that the FTA has provided to state and local agencies. Number one, on how to implement environmental justice into planning projects and activities, and number two, how agencies need to comply with Title VI, which prohibits actions that deny minority or low-income populations a fair share of the benefits of transportation spending. Their guidance also requires an upfront equity analysis to identify potential adverse impacts on minority and low-income populations. And finally, we have a new local hire experimental program that DOT has implemented that will allow city and state departments of transportation to set economic and geographic preferences when hiring for local contracts to build roads, bridges, and transit facilities. This is pretty groundbreaking because we've had a prohibition on local hiring that has failed to serve communities most in need of good transportation jobs. Research has shown that low-income workers and communities of color are vastly underrepresented in jobs in the transportation sector. And so this new local hire program will promote employment of local low-income workers. And even though it is established for a one-year trial period, there has already been federal transportation leadership that has signaled a desire to make this trial program more permanent. So now I'm going to shift over and discuss some of the work we've been doing in California to prioritize equity in our fairly new active transportation program. This program was created in 2013 by Senate Bill 99. It was created because our governor decided to consolidate all the state biking and walking funding sources into one program, and folks were pretty concerned about how this was going to be implemented. The program is funded at roughly $360 million over 3 years, so about $120 million per year, and half of the funding is administered through a statewide competitive grant program. The entire program is competitive, but half of it is run through the statewide, and then the other half is administered by large urban MPOs and small rural areas. So I'm just going to discuss a little bit about the importance of investing in of providing walking and biking investments in disadvantaged communities, how they're being defined in this program, what it means to benefit communities, some strategies for implementing successful projects that benefit disadvantaged communities, and some information on just addressing displacement. So when this program was being created, one of our primary asks was that a targeting of the dollars needs to go to our most vulnerable people in this state. And so we were able to get this in the actual statute that a minimum of 25% of the funding must flow to projects benefiting disadvantaged communities. And it is written into the statute that disadvantaged communities must fully share in the benefits of the program. And these next slides, I just want to provide a couple snapshots on that really show the need for walking and biking infrastructure in disadvantaged communities. As you can see, many places suffer from patterns of longstanding disinvestment and neglect, and really lack, all kinds of safe walking and biking infrastructure. And so by targeting dollars in a way that meaningfully addresses the mobility and safety needs of vulnerable residents, we can ensure that all Californians have access to safe, walkable, and bikeable communities regardless of race, place, or income. So an important part of our work and of getting equity prioritized in this program was on how are we going to define disadvantaged communities, and how are we going to make sure that the dollars are really going to the places that need them the most. And so we advocated to have a menu of options for the definition of disadvantaged communities in order to ensure that we really capture all of our most sort of disinvested, impoverished communities in California. So in order to be considered disadvantaged, the community only has to meet one of the following criteria. The first one is a census tract with a median household income at or below 80% of the state median household income. The second criteria is a census tract identified as among the most disadvantaged 25% in our CalEnviro screen score, which is a tool that combines several health, environmental, and socioeconomic metrics to identify places in California that have very high levels of health and environmental burdens and that are further compounded by high rates of poverty and other socioeconomic factors. And this is a really, this does capture a lot of places that have these compounded issues, facing high environmental toxicity and poor health outcomes, et cetera. But it does fail to capture other very high poverty areas that may not have the same degree of environmental burdens, and so they don't show up on this. So it was very important that we not rely solely on this tool. The third criteria is more applicable to Safe Routes to Schools projects, where a project benefiting a disadvantaged community would be where there's a school that has at least 75% of projects, public school students in the project area are eligible for the free or reduced price meal program. And then finally, if a community cannot meet any of those criteria, they do have the option to submit for consideration a quantitative assessment showing why they are disadvantaged. And we wanted to include this because there are several very small sort of pockets of poverty in California that lack accurate census data due to either the size of their community or being very close to a very large high-income community. And so we wanted to make sure that they still had access to this program. And so in the past, these communities have actually gathered their own income level data. So they go door to door collecting their data. And they've submitted this for state water programs. And this has been able to be eligible in the past. And so we wanted to make sure that this was eligible in this program as well. Another really important consideration for a lot of us who are advocating for equity in this program is around how are we defining the benefit to disadvantaged communities. It's one thing to define what a disadvantaged community is, but it's much more difficult to define what do we mean by providing a benefit. And so because this can be very subjective, we've had to work very hard to have clear sort of language and guidance in the actual guidelines and the program application. And so we were able to get this definition in the guidelines that the project must clearly demonstrate a direct, meaningful, and assured benefit. And also there is guidance in the application that directs applicants that regardless of whether the project is within the community or outside of it, it has to clearly serve and prioritize residents living in that disadvantaged community. Unfortunately, in the first cycle, many applicants incorrectly assumed that geographic location sufficiently satisfied this scoring criteria, and they didn't explain how disadvantaged community residents would access, use, or otherwise directly benefit from the project. So here's some additional language on what it means to benefit disadvantaged communities. This is in the guidelines. So the project must connect the disadvantaged community to commonly identified resources or amenities, such as medical facilities, employers, parks, community centers, and grocery stores, among other destinations. And the applicant also has to show a map that specifies where the census tract is of that disadvantaged community in relationship to the project site, so that there's a better understanding of how those people in that census tract are going to be able to connect to the project site. And then also in really implementing this equity mandate effectively, we have also worked to ensure that the application process does not hold any barriers for disadvantaged communities to being competitive. Oftentimes, disadvantaged communities are under-resourced and really lack the capacity and resources to submit, successful applications despite their overwhelming unmet need. And so we wanted to make sure that that they have, preference in the application process. So 10 points, which is a pretty good amount of weight in the scoring, is awarded to projects that benefit disadvantaged communities. We also wanted to make sure that we're really advancing projects that are informed by the community, that really reflect what the community wants, that reflect, projects that are designed to, specifically meet their highest needs with regards to mobility and safety. And the one way to really get at this is to have good public participation in designing the project. And so public participation is scored at up to 15 points in the application. And then we also wanted to make sure that the projects didn't have to be explicitly listed in local or regional transportation plans. Oftentimes these communities lack planning and have not been adequately planned for, and so although the project may not show up in the transportation plan, it can still be a very high priority project for the community and very much in consistency with the actual regional transportation plan. And so they don't have to be listed in the plan, which is a huge plus for this program. And also we wanted to make sure that if there's a matching funds requirement or a preference, that disadvantaged communities are exempted from this. They were exempted from that in the first round when matching funds were required. Now matching funds are not required, but applicants are given extra points. And unfortunately, disadvantaged communities aren't exempted from this. So we are a little worried that they might not be as competitive if they don't provide matching funds. So one of the strategies that we have really been advocating for that is critical to developing successful projects is, like I said earlier, strong public participation planning processes. And so this really ensures that the projects will meet, the active transportation and safety needs of the residents, and ensure that they have access to the project, that there is going to be, community-wide public access and use of the project. And so here are some strategies for organizing, well-attended meetings and really encouraging resident participation. And these strategies we were able to get included in the application guidance document for the applicants so that they can really see what we're trying to prioritize in this program and what they should be aiming for. And many of these strategies are, very, commonly used. It's, very important to make sure that the meetings are accessible to the people that you're intending to serve. And one of the best ways to go about this is to partner with a local community-based organization that works directly with the residents. So here are some questions that are really important to be asking in the public participation process and to be describing in the application. And this was language that is in the application instructions. And this is focused on really describing the infrastructure safety or public health challenges and how this project is addressing those challenges and why there's a need for this investment. And does the project connect residents to where they want to go? What was the feedback for that? What are the primary destinations in that community, that they need to get to? And so this is, the best way to get the answers to these questions are by, speaking directly with the residents. And it's important to really demonstrate this in the application. And we were, very happy that this was included in the application guidance. Here are some additional questions that are really important to be, addressing when designing successful active transportation projects. You really want to think about how the community will be accessing the project. It's important to think about how far away do the people actually live from the access point. We have seen some projects of different walking paths or trails that, although geographically they look like they're fairly close to where people are, due to other types of physical barriers such as a major highway or railroad track or fencing or what have you, people actually can't get to the project very easily, and so it really limits the access and use. And so folks really need to be making sure that they've addressed any potential barriers to the project. Okay, and in my last slide, I just wanted to discuss the issue of displacement and the tools or local policies that advocates are pushing for to address this in California. So displacement, is becoming increasingly challenging in very hot market areas as higher income residents move back to urban centers, and that can lead to increasing housing costs, which can force many low-income residents who have been deeply rooted in those communities. It can force them to leave, And, you know, this is definitely something that is a concern in certain areas in California, especially with regards to investments in public transit and active transportation, but particularly with like transit-oriented development. And because that's, you know, oftentimes that's likely to really attract new residents who are willing to pay higher rents. And so the advocacy has really focused on how do we increase investment in these communities without causing or accelerating the displacement of low-income residents. And one of the primary strategies that folks are pushing for is to require or give preference to local jurisdictions that adopt policies that prevent displacement in order to be eligible for public funding in transit or active transportation. And this is something that people have been pushing for in our Affordable Housing and Sustainable Communities program. That's a new program in California that's funded through our cap and trade dollars that supports comprehensive investment in land use, housing, transportation, and land preservation projects. And the transportation includes transit and active transportation infrastructure investments. And the goal of this program is to reduce vehicle miles traveled and advance more sustainable development practices for the state. And because California is such a diverse state, you know, we know that there are many disadvantaged communities where displacement will really never be a huge issue, or there isn't a huge risk, such as rural disadvantaged communities in the San Joaquin Valley. And because of this, we have advocated that these areas be exempted from any anti-displacement requirement or preference in order to, you know, make sure that this program works across the state for all communities. But in places where there is a high risk, then you know, we've been pushing for this kind of requirement that there be anti-displacement policies in place. So on the slide, these are several anti-displacement policies that are meant to be administered at the local level and are aimed at preventing displacement rather than solely mitigating it. And ultimately, the program does grant a small preference to places with strategies in place, but they focus more on mitigation strategies such as relocation assistance, which doesn't prevent displacement. And there is some language that, you know, requires projects to be designed to avoid displacement, but in general, the guidance still isn't strong enough because, you know, it focuses more on mitigating displacement. So we do have a lot of work to do with that program, but I think the overall idea is not not invest in disadvantaged communities and let's not make sure that the dollars, that active transportation dollars get to these places. We definitely need those investments in our most vulnerable communities, but let's not do this in a way that ignores the very real risk of its displacement where there is that real risk. And so I think it comes down to really urging our state governments to send a clear message to localities and regions that where that risk is high, we need to be making sure we're doing whatever we can to protect against this. So there's my contact information. Please feel free to reach out with any questions. Thank you.
Unmuted.
Thank you, Erika. That was great. And I think it brought up a lot of questions that, you know, we've been looking at as well on displacement and how equitable distribution of transportation funds and it's a complex, definitely a complex question. We have had a lot of questions come in, and we'll try and work through these. I do want to remind people that the question box can be accessed by clicking on the little orange tab, and we'll try and get to as many of these as we can. I do want to just mention to people, because a couple people have asked, this webinar is being recorded and will be up on our website probably tomorrow, maybe even today. So if you want to look at those slides again, you can access those by listening to the recording and looking at the slides. So we did have a couple questions about the maps I think someone wanted to know if the maps that we had at the beginning were broken down by census tract or by another level.
Census
And,
block group.
and they're by census block, so I think we did mention that. Someone also did ask about the maps on Madison Area Technical College and whether they were what they were measuring. So I'm just going to go back to that one. Are they measuring access to households or household access to these locations? I think the maps actually are.
It's household access to those locations. So we're measuring from households to those destinations.
But these maps are not just those locations. They're access to everything.
They are. We did two. If you go to the one in front of it, it's access to everything. So from the different block groups, you see different levels of access. So the lighter beige, if you're in that area, there's those number we have somebody else on the call to jump in who made these maps to jump in if I'm doing this incorrectly. But so the downtown core, the lighter areas, there's between 70,000 and 100,000 households that are able to access anywhere by transit within 30 minutes. And then if you go to the dark orange blobs, those census blocks, there's only it has really crummy transit access, so there's no more than 148 households in that census block that are able to access by transit a variety of destinations in the city. Does that make sense? I mean, it's different from how the measures are normally done. We wanted to look at access to many destinations as opposed to just a few, like just a job access measure.
So these maps represent both things like libraries, schools, jobs, grocery stores, parks, everything. And the MATC map simply indicates the location of the various different campuses that they are either considering or that they actually have now. So, okay, I'm just sort of scrolling through some of the questions here. How do you weight different types of destinations when you aggregate everything into a comprehensive measure of opportunity?
And I was looking at that question as it came in, and I think it's going to be very specific to your community. And that's maybe the best answer I can give you, but because each community has a different set of values and land use that's already on the ground, that's going to change how you weight things, which is hopefully more helpful rather than less as an answer.
Okay. So, sorry, I'm just sort of looking through here. For Erika, there's a question on, is transit equity integrated into the scenario planning that CalThorpe is doing for California to help communities meet the 2030 climate action goals? Are you familiar with that, Erika?
The what? The
CalThorpe and Associates is doing a scenario. They're helping California meet the 2030 climate action goals, and I think they're asking if you're familiar with whether transit equity is integrated into the scenario planning.
I'm not, but in our work thus far with Caltrans and the California Transportation Commission, in other sort of planning programs such as the California Transportation Plan, equity is not often hardly embedded at all. So I would think that if it's there, it might not be there in a very strong way, or it might be absent. But I'm not sure.
Okay, thank you. We did have a question on considering distance to bike share as an equity measure. Obviously, that's only going to be considered in communities that have bike share, but I don't know if that was considered in any of our,
Um,
if you looked at that in the equity measures.
We haven't dug into that enough at this point for me to. Erika, do you have anything on that?
No, I don't. I don't know how if how widespread that is in disadvantaged communities.
And also, there aren't that many cities that have bike share, so it's going to be pretty specific to cities that have that. So maybe on a local level, if they have bike share, that might be something they might consider.
I was sort of thinking about when bike share went in New York City, there were communities of color like Bed-Stuy that didn't initially have bike share available. Now they do. So I think there have been considerations of equitable provision of bike share that's just starting to bubble to the surface in the conversation about bike share. But I don't know if they've gotten to looking at distances between the bike share stations as part of the consideration. So that's a really good point.
I'm just scrolling down so that if people want to reach Erika or PolicyLink, you can get that information. So we just have a couple more questions. I know we've run over a little bit, but I think it's a great discussion. Someone asked if we had recommendations on equity measures for long-term study that is predicting outcomes 50 years into the future. That's a long time for almost anything, but maybe it's something I can throw up there.
Yeah, I'll just jump in, but it seems to me that recommending measures for that long-term study, you would want to set up some basic measures and put them in your transportation improvement plan, or if you're with a city, with your longer range transportation plan, which might be, maybe a 5-year plan, but you're going, say there's some policy recommendations that go into that plan and changes are made based on equity, you would probably want to revisit those when the plan is revised. I mean, the 50-year time frame, I'm not really sure what I would say for that. Do you have anything, Erika?
I would just second what you said, Mary.
I think a lot of things in communities can change over 50 years. Everything from how we're moving about to income levels in different communities can change considerably in 50 years. So I think it would be tough.
Yeah, so we're having trouble answering because it's really dynamic. A question. It's a very good question, though.
And finally, we had one more question come in. I'm just seeing, we do have a few more here. It looks like the measures were looking more at creating equality of the 3 factors you mentioned. This is for Mary. So I'm curious about the distinction between equality and equity, and what equity versus equality work is or means or looks like.
Can we go back to my slides with the measures?
Can you scroll in? Oh, I can't. Okay.
Yeah, I don't have control. So I hadn't thought about it that way.
Any particular? This one?
I'm gonna assume we're looking at accessibility versus affordability versus health and safety, which shouldn't be a versus. I hadn't thought about it as equality versus equity, so I guess I don't really know how to answer that question, other than to say I hadn't, I hadn't been trying. The intention in the work we've been doing at SSTI has not been to evaluate equality in relation to equity. We've been primarily looking at how to measure equitable provision of transportation among differing population groups, and what can be done to better change policies to improve equity outcomes in those transportation groups and track those changes over time.
Okay, someone jumped in and said equality refers to comparable benefits and impacts of policy consideration being considered. Equity refers to filling gaps that exist to ensure equal outcomes. Most plans don't start with a needs assessment. So that's something I'm going to just sort of mark, and we can take a look at that as we read our report.
Yeah, thank you for that.
So we had two really good things that I wanted to mention before we log off here. One is a specific question on the decay factor slide. So I'm going to just go to the decay factor and see if you can.
Give that to Chris.
Okay, Chris McCahill is also on. He can explain that. Are you still on, Chris?
Yes, this is Chris. What's the question?
They want you to explain the decay factor slide that I have up there.
So the decay factor is derived from usually from household travel surveys, and it basically just measures how likely trips are to be made within the certain given travel times. So a destination such as a grocery store, restaurant, etc., is most valuable when it's within 5 minutes, and then when it's within 10 minutes, it drops down to about 25% as valuable based on the travel surveys. And this curve is a general one for all destinations, but this could vary for for work trips versus non-work trips, and it could vary by mode, and it could vary by geographic area. Okay.
So the idea is that the closer in ones are more valuable because people are more likely to take them. Yep. So I'm just going to move to a final slide here. If anyone would like to keep up with SSTI, you can get more information about us on our website, ssti.us, and you can follow us on Twitter at SmartTransp. And you can subscribe to our newsletter on our website. We will have the slides and a recording of the webinar up tomorrow. We do have one more question, which I want to get to, but I just wanted to let people know where to get further information if they want it. And the final question we had come in was, one way to talk about transportation equity is to talk about the number of people who are transportation insecure and work to reduce that number to zero. Have you tried to define what transportation insecure is, which I think is a great question.
That is a great question. No, we haven't framed it in that way, but that's a really good frame, and I'm interested in exploring it further.
So if the person who asked that question wants to email us, we would love to hear more about if you have any ideas on that. So I want to thank everybody who stuck with us through the end of this, even though we did run over. And thank you for everyone for joining us. And we'll have these slides and the recording of the webinar up on our website tomorrow. And I invite you to subscribe to our newsletter. We're not going to subscribe you. You can go ahead and sign up if you want to on our website, ssti.us. And thank you to Erika and to Mary for a wonderful discussion of equity and transportation. Thanks a lot.